A 50-year-old basketball coach catches ancient disease from mummies. You won't believe what happened next. Imagine a disease so stealthy it's been hiding in plain sight for thousands of years. From ancient Egyptian mummies to modern-day athletes, this silent invader has claimed millions of lives. Today, we uncover the shocking truth about a basketball coach's battle with a 5,000-year-old killer. Welcome back, friends. Today, we're diving into a case that will challenge everything you thought you knew about infectious disease. We'll explore how an ancient ailment managed to sneak its way into the life of a seemingly 50-year-old basketball coach, leaving doctors baffled and viewers like you on the edge of their seats. Our story begins with a 50-year-old male, a professional basketball coach who had recently returned to the US after spending several years in Colombia. He seemed seemingly healthy at first, a former smoker who had quit over 15 years ago with only a minor thyroid condition. But then, the symptoms started: chest pain, cough, fevers, night sweats, and a concerning loss of appetite. As medical professionals began their investigation, the plot thickened. X-rays and CT scans revealed suspicious masses in his lungs and lymph nodes. But the real shocker came when they discovered a destructive lesion in his spine, specifically in the C4 vertebra. At first glance, it looked like a terrifying case of advanced cancer. But appearance can be deceiving, and this case was about to take a dramatic turn. As doctors scrambled to solve this medical mystery, they faced a series of twists and turns. Initial bronchoscopy, negative for malignancy. Repeat endobronchial ultrasound and biopsy, still no sign of cancer. CT biopsy of the vertebral lesion, chronic granulomatous inflammation with necrosis. At this point, our medical detectives were scratching their heads. It looked like a cancer, but all tests said otherwise. Then came the breakthrough. Cultures from bronchial secretions grew Mycobacterium tuberculosis. Our coach did not have cancer, he had tuberculosis of the spine. A leading infectious disease specialist at the hospital commented on his case. Tuberculosis is often called the great imitator because it can mimic so many other diseases. In low-incidence countries like the US, it's easy to overlook, but we must always keep it in our differential, especially for patients with a history of travel to high-burden areas. Alright, now let's play a quick game. Can you spot the TB clues? I'll show you a list of symptoms and risk factors. Your job is to identify the ones that are associated with tuberculosis. Ready? Go! 1. Recent international travel. 2. Chronic cough. 3. Unexplained weight loss. 4. Blue-tinted skin. 5. Night sweats. The correct answers are 1, 2, 3, and 5. How many did you get right? Remember, TB can affect many parts of the body, not just the lungs. Did you know that TB was found in the bones of ancient Egyptian mummies dating back to 3400 BC? That's right, this disease has been haunting humanity for over 5,000 years. According to the World Health Organization, tuberculosis remains one of the top 10 causes of death worldwide. In 2020, an estimated 10 million people fell ill with TB globally, with 1.5 million deaths attributed to this disease. Alright, let's play another game. I'll show you two lists of symptoms. One is for lung cancer, the other for pulmonary TB. Can you spot the difference? You have 10 seconds. List A: persistent cough, coughing up blood, chest pain, unexplained weight loss, fatigue. List B: persistent cough, coughing up blood, night sweats, unexplained weight loss, fever. Did you catch it? List A is for lung cancer and list B is pulmonary TB. The key difference: chest pain in cancer, night sweats and fever in TB. But wow, they're quite similar, right? No wonder TB is called the great imitator. Alright, now here's where things get really interesting. Our coach did not just have any old TB, he had TB of the spine, also known as Pott's disease. This form of TB is like a stealthy ninja, sneaking past the lungs and infiltrating the bones. Did you know TB of the spine accounts for less than 5% of all TB cases in Europe and the US? Talk about a rare diagnosis. Alright friends, it's time to test your knowledge. Get ready for a lightning round of true or false. Number 1. TB can only affect the lungs. Number 2. You can get TB from shaking hands with someone who has it. Number 3. TB has been around for over 5,000 years. Number 4. All TB infections are active and contagious. Number 5. TB is completely eradicated in developed countries? Alright, so the answers are number 1 is false, number 2 is also false, number 3 is true, number 4 is also false, and number 5 again false. Did you know? Remember, knowledge is power in the fight against TB. An orthopedic specialist at the hospital added, TB of the spine or Pott's disease is a diagnostic challenge. It often mimics metastatic cancer or other spinal infections. The key is to consider TB in patients with risk factors, even in low incidence countries. Early diagnosis can prevent severe complications like paralysis. Here's another fascinating tidbit. The BCG vaccine used to prevent TB is also used as a potential treatment for bladder cancer. Talk about a versatile vaccine. Let's look at another important statistic. According to the CDC, in 2020, the TB incidence rate in the US was 2.2 cases per 100,000 persons. However, this rate varies significantly based on the country of birth. Now that you have seen the hidden danger of TB, it's time to take action. If you have traveled to a high-risk area or experienced any symptoms we discussed, don't hesitate to get checked. Remember, early detection can save lives, not just yours, but also those around you. From ancient mummies to modern-day athletes, tuberculosis has proven to be a formidable foe. But with awareness, early detection, and proper treatment, we can fight back. Stay vigilant, stay informed, and most importantly, stay healthy. If you liked today's episode, don't forget to check out our last week's episode where we talk about an unusual complication after taking antibiotics.